Okay, welcome everyone. Thank you, Chelsea, for joining me today. You know, I've been really your admirer for many years, and your work at the foundation and all you have achieved really I also want to CGI. I am a member of CGI. That's when I was able to get my first platform. Chelsea, I remember that's when we met. I was a student, you know what I mean? Yes. And I admire the work of the CGIU all over the world, they're doing all over the world. And they gave me a good platform, really. When I was still new from Kenya, when I came to the US, it was really powerful to meet other young leaders who up to now have been my friend. So Chelsea, I want to go more about, I've been reading what you've been talking about. So recently I've been delighted to see you raising voices on the reality of fighting this pandemic in fragile countries, which I think Kenya is one of them, and the developing countries. And I could agree with you more with your comment. I remember you said something like this: as a basic matter of justice and humanity and self-interest, there could not be a more urgent time for the United States to return to its historical tradition of global leadership. I think you remember the Second World War, the First World War, America, and during every time there's a pandemic, America has been known, for taking that leadership and guiding the world. So I really love that comment that you've been putting across. So global leadership comes in many forms, and I am so excited to discuss this with you. So let's dive in. As you know, I'm very passionate about our topic today. So I get carried away. I speak fast, Chelsea. So try to guide me if I'm going too fast, please. Thank you.
I'm trying to keep up.
Yeah. So Chelsea, welcome, please.
Well, no, Kennedy, thank you so much. I know, Kennedy, I think we've known each other for, goodness, almost a decade. Not quite, but almost. I know, a long time friend. And, I'm such a kind of long admirer of your work with SHOFCO, and so grateful for your friendship and your leadership. And I think as we're seeing, kind of painfully for me as an American and also as someone who cares so desperately about global public health, we're seeing the United States kind of step back from our leadership role around the world. It just means we need others to continue to step forward, including you. And so I think, one of the things that I want to hear from you directly this kind of midday for me, I know this evening for you in Kenya, is to hear kind of what is happening in Kenya, kind of what is happening in Kibera, and kind of what are you seeing from your perspective at SHOFCO and beyond?
Thank you, Chelsea. As you see, in terms of COVID, we have been really hit hard as I call ourselves, we are the third frontier for this pandemic. And in some ways, I'm also a little bit hopeful. If you see, Africa has done so much better than many Western world. So I think they took it very quickly, fast, immediately. And, we have seen a lot of changes in African governments, and they put some measures, especially in Kenya, and that really helped us a lot because I was so worried about Africa, to be told. And right now we have over 1,000 cases of people who have been infected, but that's only less than 30,000 people who have been tested. In Kenya, we have almost 50 million. But I see there's a challenge we're going to face because it's more than health disaster. It's also going to be more economic disaster. And that's why, Chelsea, I think things to do with the debt reliefs for these countries are very, very important because we are going to a crisis. And where I work in informal settlement, as you see things, I am scared that Africa might experience a lot of riots. Chelsea, you can't get food in your house. There is no job. We talk about social distancing, which is a luxury. Truth be told, how do you have social distancing when you live in a 10 by 10 room? You share a toilet with over 50 families. You live under $2. You don't have a freezer. You know what I mean? You don't have a fridge. So so there will be a challenge. So we we need to really work hard on this. And for me, the solution is that as the government policy have been done, we need bottom-up solution.
Yeah, well, Kennedy, I so strongly agree. And in the kind of piece that you kind of quoted earlier that I wrote that was published a few days ago, when I've advocated for debt relief for 20 years and believe it is kind of always past time and certainly urgent now, and that also just has to be part of kind of global solidarity. But as you kind of talk about the kind of challenges, to put it mildly, the impossibilities really of social distancing in Kibera and in the other kind of informal settlements where SHOFCO kind of works or partners, could you talk about kind of what you are doing to try to help people understand kind of this threat, kind of what is happening, how they're responding, how you're helping kind of people respond, and especially could you talk about what's happening with your schools and kind of how you're still working to educate all of the girls whose dreams deserve to still be nurtured in this moment?
Thanks. So I think, Chelsea, you've heard so many times people talk that coronavirus, COVID-19, is equalizer for the rich and the poor.
It's not an equalizer. It exposes inequalities.
Got it. So there's a lot of talks about that. Makes me so angry. It's not true, as you said. Because it just exposed the reality on the ground. So, for example, America, and look at Africa, for example, we don't have enough data, internet. How do you expect these kids don't have computers in their houses? How is the learning going to happen? Even for our student in Kibera School for Girls and Matari School for Girls. So it's a really big challenge. So we are being affected, but I also see hope when there is this kind of disaster. One of them is the power of community grassroots power. For example, when this thing happens, our leaders across 14 slums in Kenya were able to set up hand washing stations. And Chelsea, I know you are into the health, you did that in your university. So you see this, for example, is that we don't need rocket science to fight corona, honestly. We don't need experts on the ground. So we need a basic need. So just water to clean your hand. How can you use water to clean your hand if you don't have clean water to drink? You know what I mean? So what we did were those kind of basic needs, because I believe strongly that communities can really prevent corona. They love their neighbors. Nobody wants to kill their neighbors, but they live in small rooms. They need to have food on the table. They need clean water. So what SHOFCO did is that to try to have a massive hand washing stations, clean water, you come wash your hands with soap, and we use our network for distribution to give food to those we can reach. So I've seen that as a big impact. And when I met the minister, who is a very good man, Minister of Health, that's I think a couple of months ago, and he asked me, Kennedy, what is the problem on the ground? What's going to happen if you do lockdown fully in Kenya? And I told him, it's not going to happen. It's going to be tough. You have to find a way. I say, you can only do that if you provide cash transfer to this household, because that's going to promote the local economy or the slum economy, those small kiosks, shops, Otherwise, people will not agree on that. And right now, the government has a plan on how to give money to they have been given a little bit. They want to make it much more large scale because people need food. And I told the minister that, can you believe they're saying this in Kibera? Like, I better die from corona than to die from starvation. And that's a really powerful word. No, that's really powerful that they're willing, they better die from corona than dying from starvation. So I feel like this is something that, first of all, who is suffering most are people living in informal settlement. And to be told, why do we have slums? Why do we have these houses, these shanties? Because they've been neglected. So I hope we are learning from this mistake. And Chelsea, this is the best time that we need to appreciate our health community workers who are poor, who live with us in our communities. They're the one helping us now on the ground.
And I think, Kennedy, thank you for talking about community health workers, because we know that community health workers, who by definition are often from the communities in which they're working and serving, to protect basic kind of public health and deliver basic health services, vaccines, kind of, to check kind of babies' weight, kind of height, are they growing appropriately, their head circumference, all that vital work that has often been disrupted now by coronavirus. And we desperately need not only to kind of figure out how to kind of fight this threat, but not lose ground in ensuring that we are still helping to protect especially expectant mothers, newborns, babies, children. I know that is work that you've really focused on too at SHOFCO.
And just to add on that, very important here is that most of the time, poor people, I think everywhere in the world, they are angry with the government. So there's something called trust. So there is no trust. So we have what's called myth. When you're taken for your corona, they come to test you, are like, no, I don't trust the government. You know what I mean? So, and I think that what I've been talking to the government of Kenya is that how do we empower these community health workers? How do we empower community leaders? Because they are trusted, they are on the ground. I mean, so I know WHO has something called social distancing. I love the word. I think I wish it could be called physical distancing, okay? Anyway, so how do you take this messaging from the Ministry of Health in Kenya and the WHO and put it for the community health workers to translate it to the local people to see it in their own way? Because trust is very important. At this time, I'm sure even in America, so if you don't trust your government, it's big, So, and I believe that community health workers, they are the neighbors. They live in those communities. So it is a high time we need to support community grassroots organizations that have been there before the pandemic.
And Kennedy, I think one of the things that has been so extraordinary, actually, I think, about your leadership is how you have kind of maintained and continued to build that trust kind of in the communities where you work, but also kind of with the Kenyan government. I mean, as you were talking earlier, you were talking about a conversation you had with kind of the Minister of Health. Can you, I imagine there are a lot of people listening to us today who are really interested in how you kind of did that before the COVID-19 pandemic and how you're maintaining that trust in this moment, how you kind of think about kind of this resource that you really have built kind of trust to help kind of protect and serve the communities you work in, even as you have to kind of continue to reach out and talk to the Kenyan leadership, who I know you don't agree with on everything.
Yes, and you're right, Chelsea. I think at this time, I think the government, we have to find ways of working with the government as possible. And for example, and you also have to win the trust from them. You have to win the trust. For example, I think SHOFCO has done a good job. Even the President of Kenya, His Excellency President Kenyatta, in his speech, he talked about SHOFCO work. He was impressed to see what we're doing on the ground. And I believe this. Chelsea, I don't like complaining. I know that about my story. I like to come with solutions. And I think the government now, they're looking for solutions. I can't spend my time fighting them. I spend my time telling them, hey, look at what you're doing here. How can we work on this? For example, right now, there was a problem in Kibera. Some of my leaders in Kibera, they were fighting not to be tested. And I know they're scared.
They didn't want to be tested.
Yeah, they don't want to be tested. You see? Why? It's about trust. They're like, no, they're going to take us and kill us. It is not true. So you have to jump in and talk to one of the leaders, and they really allowed to be tested. And now people are now doing it voluntarily in Kibera, with the CDC and Kenyan government. They have this venture together. So I'm so impressed. And I've been telling the government that we can't use force. Force can't work. I was seeing places where police are becoming brutality. But if we can I call it community ownership. Let them own this coronavirus. Let them know that this thing is going to kill us. In that way, it becomes very important. So I think sometimes government get tired, actually, in our continent, when people just keep on complaining. And I think we should approach our governments with plan, solutions. That's in my way. And sometimes there's a lot of corruption online. But truth be told is that we can engage the government. We have to find a way when they are wrong. We have to talk to them, tell them what they're doing wrong. And at the same time, we know they have a machinery, the health system that they have in the country. How do we help them? For example, Chelsea, I talked to them that we're going to use SHOFCO facility to be an isolation center. You see? Because government don't have buildings in the slum. So we're like, okay, we have it. So when this thing becomes too serious that there's no spaces, we're going to use our building to help the government. So government starts seeing you as an ally.
No, I think you've been such a smart and effective leader, kind of for and with your community. And I think we all can really learn from that and learn from you. And, you know, Kennedy, I think the most common question that kind of we got in advance of this conversation today was kind of, what can people do to help? How can people support what you're doing kind of directly in Kibera? How can people kind of learn from what you're doing in Kibera kind of to help within their own communities? And I really think, you know, just talking about kind of specifically kind of how people can support your work in Kibera, but also specifically what you think people can learn from your work in Kibera, I think would be really interesting to people listening to us today, because it was the most common question we received in advance of our conversation.
Yes, and I want to talk about SHOFCO, but before I go there is a challenge we are facing in the world. So I've seen a lot of high cases in my community about gender-based violence against women has got so high. Child mortality, you know, women can't go to the hospital to deliver, you know, there's a lot of challenges. So Chelsea, I see right now globally, we are faced with mental health challenge. I always ask everybody, wherever they listen to, please try to call your friends. Try to check out on them fast. Just a quick phone call. I was thinking of you. That's very important. I mean, because it's a lonely time and you can feel useless. I mean, just being in the house, you know, you don't know what to do, you know. So it's like less just by simple things, checking on each other.
But Kennedy also, so I was lucky enough to be, my whole family, like all of us, including baby Jasper, were at Kennedy's birthday Zoom last week. And
yes.
We have so much more serious things we need to also continue to talk about. But I do think what you have said is really important. It's important that we continue to remain connected in this moment, even when we're so far apart. And part of that is calling to check on our loved ones. I think especially kind of, you know, our friends, our family members who may live alone, who may be isolating in place alone, but also to show up for moments of celebration, even if we show up in this way. I mean, Kenny, I think there were like 60 people at your birthday Zoom. It was amazing.
Yes.
From all over the world. And so, you know, thank you to Jess, Kennedy's wife, who organized all of us. But I do think this is an important point of how we continue to stay in our communities with one another, for one another, even while, for those of us who have the privilege, and it is completely a privilege, are staying apart.
It's true, Chelsea. So I was really surprised and touched because honestly, since this thing happened in Kenya, I've been working hard and focusing on helping other people. So I never put time on myself, I'll be honest. So when I got that surprise, seeing your face, seeing my friends around the world on my birthday, I turned to be like a small baby. I was so happy and shocked with the love of people. You know, I know people are busy, but to do that, it really gave me morale. So those small things are powerful. So going back to SHOFCO, right now, organizations are being affected. Truth be told, there is no money. This is called this emergency. And most of the nonprofit like SHOFCO don't have emergency funding. We are not emergency organization, but we are bonded in the community. So we need to provide clean water. We need to give food to the community where we serve. And all these things really, it costs money. And what I love about SHOFCO is that even small, even $1, you know, that goes a long way. Right now, we are giving water for free. But we have to pay someone who stay at the water place. We have to give away masks, because it's very important. We have to bring sanitations. You know, and also Chelsea, also we have health clinics in the community where we serve. And apart from Corona, I'll be honest with you, we're going to be affected with vaccination. Chelsea, I know the foundation of Chaya.
I know, I'm so worried about this.
Chelsea, malaria might come back again in a very scary way. I'm being honest with you. So
polio is already coming back. I mean,
polio is coming back.
You know, last week, you know, Niger and Chad reported their first polio cases in years. I mean, Niger hadn't had a polio case since 2012. So we know that when we stop routine vaccinations for diseases that we haven't eliminated, which is every disease except for smallpox, they really can come fiercely and destructively back.
That's my worry, Chelsea, because we are now focusing on this corona, but we are forgetting the multiple effects that it has. So we need, and women health. For me, I'm sorry to say this, I feel women health for me is a basic need.
It is.
You know,
it's one of the reasons you started SHOFCO, right? It's one of the reasons you started SHOFCO.
So yeah, so those things really need resources. I mean, so I would like to people that whatever contribution you have right now is not going to salaries, it's not going to anything. For us now, how do we save life? Chelsea, urbanization is one of the greatest things that is happening in the world, which is also happening in the Western world, and that's really exposing the inequality that we have. And nobody should die because they are poor. And just to add also into this, I'm also worried is that people like you, Chelsea, who have the big voice that can be listened, we need to start fighting that when we get vaccination, when we get this medicine, I am scared that developing countries will just be left aside to die. It happened with the HIV/AIDS, Chelsea, in the 1980s, 90s. So this might happen again unless we start fighting now that all lives matter. African lives matter, American lives matter, everybody's life matter. And we should not come with a vaccine that is all about who is rich or a powerful nation. So Chelsea, that's the thing I'm really worried about my continent.
I completely, emphatically agree. Kennedy, I want to ask some of the other questions that we were sent in advance, because I imagine if they were asked by one person, they're probably interesting to hopefully at least more than one, and maybe more. So one of the questions I want to ask is kind of what, I think this is a good segue from what you just were saying, Kennedy, about how, when we get a vaccine, and it won't be in 9 months, but hopefully it's not in 10 years. So when we get a vaccine, it needs to be equitably distributed. The first question from Elliot Smith from CNBC, what more could and should the international community, particularly economic power such as the US and Western Europe, be doing to support the efforts of both authorities and NGOs on the ground in vulnerable communities in Kenya and elsewhere across Africa? So what more do you think should be happening right now?
Yes, so I think right now we're going to have a very big economic impact in Kenya, in Africa. So I think what needs to be done is that, as I talk about how much these powerful countries, developed countries, they should still come together and not forget Africa. I mean, because as you see what's happening now is a little bit, I don't see much effort happening, you know what I mean? I don't see people coming together and discussing how they're going to help, the countries that are dragging down, so it's something that we need to work on that. And I also feel like debt relief is very important. If this country can promise us they're going to use the money to help their people, not going to fill people's pocket, because that would be terrible, you know what I mean?
And we saw that after debt relief in 2001, where the money that wasn't going to the kind of usurious interest rates to the World Bank and elsewhere was invested predominantly in health and education. So like we have real evidence for that in our lifetimes. So second question from Zoe, a 2020 CGIU student at Edinburgh, at the University of Edinburgh, is how might your work, Kennedy, in Kenya be useful in other African countries and even globally?
Yes. So I feel what we're doing here is that it's very simple. We are showing the world that the power of community, grassroots, and I see is that we have to start believing in community solutions. We need to empower communities, and the what SHOFCO does is to give tools so that community can solve their own problems, So I think what we are doing is not unique to be told. I think that most of the time we always think that the solutions come from the top. And Chelsea, days when malaria was a big thing and nets, people were given nets and they were using it for doing what? For fishing. Because they never owned it. It's because somebody come with the idea, tell you, use nets. No. But when community was start solving the problem and they were owning it, you saw what happened. They could use the net for the right thing. So we should not ignore community. solutions that are coming from the bottom can be really powerful. So what SHOFCO is doing here is just a blueprint that anywhere it can happen in New York, it can happen in anywhere in the world when we start believing in the community solutions. Yeah.
You know, well, certainly I think in places where we've been failed by our government, which is certainly true here in the United States, repeatedly failed by our government, we do need community solutions desperately. Another question really kind of goes back to something that we started to talk about before, which is from Joan Gamble. And she asks, kind of what have you seen in terms of domestic violence and intimate partner violence increasing, and kind of what can we do to try to help women and children who are in especially vulnerable settings right now?
Yes, it's a challenge. As we see now, let's be common sense. In a family that cannot afford food, you are there with the children in this small room. You are all stressed up. And where there's already been violence already, I think it's going to rise as we see in this informal settlement. So what do? I think the best thing the SHOFCO is doing, which we also work with the Ministry of Gender, and she talked about our work recently about that. So we have safe houses that they are secret. Nobody knows where they are, but SHOFCO runs them. It's underground, okay? Where those women who are being abused can call. There's a number they can call, and our people work with the police so they can come and rescue you. So I feel right now the government should invest mostly on this free toll. I mean, who can you call? We have to have that way of calling, you know. And the last one, as I talk about community loving themselves, I also think it's a high time that in each community to start looking on each other, to check on them. You know what I mean? If somebody has an issue, they call SHOFCO. And I'm sure around the world, we have places that are working on gender-based violence. So we just need to talk about it more and give what to do next. If you're being abused, this is the number to call. I think that's the best way to handle this. But now the cases are very high, as I see in the community.
Yes, and I think again, you know, this just underscores how important it is to have community-based solutions, and to ensure that people, and especially women in this case, know kind of who in their community they can reach out to for help. I think this is probably our last question, but one that is from another CGIU student, and likely one that will be interesting to people listening, and hopefully actually is one that we're all already thinking about already. So Kennedy, what is kind of one piece, although you can have more than one piece of advice that you would give to change makers and activists who are torn between dedicating themselves toward kind of public or kind of civic service activism, and not wanting to expose themselves, is kind of how this CGIU student framed it. So kind of what advice would you have kind of to the student asking this question?
Yes. So this is the time that during crisis, that's when we identified great leaders. And I remember in America, when the economy was down and we saw leaders coming out, like President Bill Clinton, I remember that very well. And so we saw that because when you have to be tempted, I mean, and we have seen also globally leaders who cannot be able to deliver. So it's the same thing with activists, with leaders in the communities. So right now, first of all, you have to take care of yourself because we need you. I don't want any leader, young leader, to just go expose themselves because, you know, no, that's not good. It's a time to be strategic, protect yourself as you go to the community, I mean, and this is the time that leaders need to talk among themselves, activists, you know, how do they share the ideas? How do they do that, you know? Because don't forget, there is another world after COVID-19, okay? So we need to be alive for that. And I would like to tell leaders who are really energetic and angry that it's a high time to protect yourself. Really, it's very, very important. We need you. I mean, and there's many ways you can help now. I mean, you can be strategic, advising your community. You know, trying to see what you can do because now it's a challenge, and all the time leadership comes when it's a challenge. Yeah, so don't give up. And don't lose hope. You know what I mean? And I also take this time for leaders, those who can be on the ground. Please, it's a time to meditate, reflect, and energize yourself for the
Well,
long.
Kennedy, I think about something that Jim Kim, one of the founders of Partners in Health, said, that optimism is a moral choice. And I think there is so much to be angry about right now. I mean, I'm angry all the time, and yet I also choose to be optimistic alongside that anger, partly because I'm lucky enough to know and love and support you, Kennedy, and all that you're doing kind of with SHOFCO in Cabrera. So thank you. Thank you for the conversation today, and even more for your leadership and all you're doing every day.
Thank you, Chelsea. It was really good to catch up with you. And please stay safe. And I want to thank everyone who joined it. I think we have almost over 500 people. I hope they found it interesting. And thank you so much, really. It was good sharing with you.
Thank you.
I say asante. Bye-bye. Be safe.